Okay. So this horse is a thoroughbred racehorse, hurdler. It's had an overground scope where we've diagnosed intermittent dorsal displacement of the soft palate. So now we're just scoping it ahead of a procedure just to make sure at rest that there's nothing that we would have missed on the overground scope, no granulomas, no subepiglottic cysts, nothing odd like that, and that the airway is clean, there's no mucus, no blood or any of those things. So just a routine scope, but you can see the picture's really good, the use of the flush is easy, and the control of the scope is pretty good. You'll also notice that we're all wearing hats. Following a beaver, how to keep your team safe, that's a policy that we're trying to adopt, because it only needs to go wrong once, and you don't need to learn that lesson twice.
My role at the practice would be mainly stud work with a bit of a medicine caseload. So actually within the clinic I do a fair brunt of the kind of gastroscopes and assist with the medical caseload here within the hospital, as well as seeing a similar caseload out on the yards as well. Keep going please, Izzy. So one of the things that I really like about these scopes is just how adjustable they are between those two environments. So it's no more hassle or faff for me to do a gastroscope in the clinic as it is for me to do one out on the road at the yard as well. Everything's very compact, everything's very portable, and the image doesn't change within the different scopes that you're using or the different screens that you're using. So MEDVos as a company we find really, really easy to deal with. They are always at the end of the phone. The technicians also let you WhatsApp them, so any kind of horse-side problems that I've experienced, we're able to quickly send a video, send it straight to the technician, check that we're happy that the scope is supposed to be doing that, or if we're concerned in any way. And then if we are concerned, or even when they've just gone back for servicing, there's always a loan scope to replace that. So it means that the practice is never without the equipment, and we can continue our kind of horse-side appointments throughout, even if the scopes are away getting serviced or having little upgrades and things. So we've just come into the entrance of the stomach here, so we'll just pause at this point to let the stomach actually inflate with air. I might just turn that up a little bit. So we're just looking at the marg applicators in front of us as the stomach inflates. We'll just give that a little bit of a minute to fill. But looking up at the top of the stomach there's no ulceration higher up, so that's good. She's nicely starved, so we can clearly see her stomach as well. So the MEDVos scopes are very, very easy to use. So previously I've used a scope with a wheel to control and to drive with, which makes it immediately a two-handed scope to use, whether to this drives with the levers. So you actually completely use the one hand to control and drive with the scope, leaving you your right hand free to be able to hold your position within the stomach or within the part of the horse that you're scoping, whilst then changing catheters or guide wires, or kind of putting biopsy forceps down your biopsy channels, and you have that right hand completely free to then aspirate without actually moving. So it's very, very simple to use. So we've just come all the way through now, and we're just at the pylorus, so the exit to the stomach. We're just having a look at it relaxing, contracting, just having a look at any ulceration around that area. There's a little bit of hyperemia and a bit of edema. Okay, I'm happy if you want to come back. Do you need any more?